So now in the final section of the morning and until lunch, we've got a Q&A session where we will answer any questions that you've put to us, have a dialogue together maybe, and to some extent, as far as it's possible in this kind of online environment, have a dialogue with you all as well. So I hope you've enjoyed the morning and found it useful and informative. We've already got quite a few questions come in. We have on the panel to answer them, all the speakers from this morning. So there's myself, Catherine, Sandy, and Paul. Not sure we've got John actually yet, but maybe he's coming. So we're ready and able to answer your questions. So I've got some that have come in for myself, and I could kick off with those. If that would be okay.
Yeah, I think that's a really good idea. John can with this.
All right. So
I've got some as well, John, but I don't know if you want.
Sorry, Tanya.
I've got some questions. I don't know. I can feed them if you want me to.
Okay. So I had some questions that came just from my presentation, which are which I can address first off, and then we can see where we go from there. So there were some sort of factual questions from people based on the language that I used. And apologies for not making that clear. It's always easy to assume when you're doing a presentation like this that everything's clearer than it actually is. So I used the term TAU in one of the slides, and someone asked, what does that mean? And it stands for treatment as usual. So when we run these trials, what we do is we are very keen to compare the therapy that we are testing, as it were, for effectiveness, compared to the regular treatments that the children and families are receiving. And the reason we do it like that is partly for practical reasons, that it's really unethical in the current state of things to ask families to stop doing certain therapies. But also, practically speaking, it's good for us. The question that we're asking and hopefully getting an answer to in these trials is, does adding a particular therapy over and above what is normally provided at the moment in a particular context, does adding that particular therapy give added value? And that's a good practical question, because it then informs people like Sandy and commissioners to say, okay, it might be worth adding in this particular therapy into everyday practice. So that's what we do and how we do it. And of course, we are very keen to measure what actually people are actually getting. And so in our publications of all the work we've done, if you'd like to get more detail, you can look up, and we detail in great detail what people have actually been getting. So that's what TAU is. There was another question about neurodevelopmental disorder and symptoms. And these are, as it were, sort of professional terms. So again, apologies for those who are not familiar with them. What we mean by a neurodevelopmental disorder is, as the term suggests, really, it's a disorder that involves neurological and brain development, but very much in a developmental context. And the term neurodevelopmental disorder these days is usually related to conditions such as autism spectrum conditions, or ADHD, attention deficit hyperactivity disorder, and some other enduring conditions of that kind that seem to be embedded in early brain and psychological development. So that's what we mean by neurodevelopmental disorders. And what we mean by symptoms are the defining characteristics of those disorders or conditions. In autism, we have a number of behavioral characteristics by which we define what the condition is and on the basis of which we make a diagnosis. So that's what we mean by the symptoms, and those are the things that can be a target for treatment in the sense of reducing their severity. There was a final question before I hand over to others about PACT in schools. And a number of you have commented on the chat function as we've gone through the morning, how useful it would be to have an intervention that actually helps schools better manage, communicate with children, and therapies that would help teachers and teaching assistants do that work. And indeed, we agree with you. And so we have developed a kind of school-based version of PACT, which uses basically the same techniques and goes into schools and uses teachers and learning support assistants as our co-partners in delivering the therapy to the children. And we have just finished a large trial where we implemented PACT in this teaching mode into schools, both mainstream and specialist schools, alongside implementing it home with parents. And we're just getting the results of that trial in now, and they'll come out in due course. But we have undertaken a good test of that kind of intervention process, and there is a protocol for that we have published. So I'm happy to give anyone more information about that if they'd like to contact me. So I think those are the only ones that came for me at the moment, but over to my colleagues to see if there are other questions that people could address.
Morning, I've got a question for Paul Wilson, which was, how would a health organisation who is not part of IMPACT access training in the use of telephone therapy?
That's a good question. Well, our study was designed with the IAP service in mind and engaged with the IAP services. The people who deliver the training in our team do it for other, particularly for third sector organisations. So if I suppose the short answer would be, if somebody wants to, the person who's asked the question wants to get in touch, I can facilitate a link up with the people who deliver the training. But the training itself has been resourced through a study for IAP services. So whether they can expand beyond that, I don't know, but certainly we can have that conversation.
There are, in fact, a couple of questions for John. Unfortunately, he's not on the panel, but I wonder if one of them's asking, how do autistic people get involved with Autistica research? I don't know whether Jonathan might be able to have a stab at that in John Sparr's absence.
Yeah, that's a great question. And the fact is, Autistica is really keen to have autistic people and families involved in their work. And they have a thing called the Discover Network, which is partly designed exactly for that purpose. There are some contact details. I think if you go to the Autistica website, you will see contact details, and they will be more than happy to reach out to you and include you in the work that they do. They're very keen and have been indeed very successful in doing that.
And another question, again, it was actually for John, but I'm sure you can all have a stab at it. What would you advise for parents who have difficulty accessing early help?
Why don't you go for that, Catherine?
Yes, we would advise parents to talk to their local healthcare providers, including a health visitor, and their GP, accessing their paediatrician. We feel that that's what this symposium is about, really, is us working together, that there isn't a simple solution, but by us bringing together, saying there's evidence for this, we don't want families to be waiting. We want them to be able to access support at the earliest opportunity when there's a concern. And we need to work together through research, through our evidence, but also through working with parents and parents' wishes, so that we can work with organisations and help them bring about that availability.
And another question, how do we get involved as parents to help change services?
Well, it's about talking together, first of all. That's why, again, part of this symposium is the start of talking together, telling us what you value, what's important to you, then being listened to. And as you know, from an academic point of view, we can do the research and evaluation, but fundamentally to get that implemented, we need to be talking to service providers. And to get the Greater Manchester funding, for example, that involved a discussion. We had a meeting with Sandy Berry, including parents, and he listened and he said this is a priority. So that's how we were able to implement the project.
Sandy, do you want to comment?
I mean, it's a hard one, isn't it, in the sense that often at the time when people need help, that they're tired, they're frustrated, and they just need that help, and they've been turned down sometimes for not very good reasons, if I'm honest, other than people are just trying to compete in bits. I guess there's a balance here. It's stick and carrot bit. So I think, as Catherine said, the talking bit can work sometimes, as they nobbled me, they rung me, that's fine, and I listen, and it's fine, and it fitted with the bits of program together, and connecting those bits are important. And there's some very good people nationally who've done that, in terms of folk with the Challenging Behaviour Foundation, folk may be aware of, in terms of bits. We've got local parent groups which we absolutely partly fund, support, including service user networks who we listen to and tell us what's going on. Sometimes you have to be more forceful and demand that. So that's the honest truth around that one. And I have to make choices sometimes about who I help, who I support, who I can't help. And I think that is the hard bit around. If you don't get that, it's really hard, but you can't give up, I guess, and you won't give up because it's your son and daughter. It's just a case of how you find the right person to try to talk to. If you can avoid getting into fights with some of us straight away, that's helpful, because some folk will just put up, as a psychologist me, the barriers automatically. So you've got to find a way in to talk. Mostly people will be able to convince, and again, we can share bits afterwards, but this is all about lobbying at a personal, at an individual local level. I mean, the evidence-based stuff, John, is really important here. Of course, I'm a psychologist and researcher and bits by background, and would want things to be evidence-based. But if things were evidence-based, then you wouldn't have the variability we've got across the country and across the world. Actually, it's who you know, how you influence, how you work that stuff through. So that personal dialogue and working through is critical.
Thank you, Sandy. I wonder, Paul, if you had a comment just generally in healthcare about this kind of process of service users or other people involved influencing policy and process.
Yeah, well, as a researcher, I mean, a lot of work is about evidence-informed decision-making to support people like Sandy in the main. In fact, you know, I do a lot of work with commissioners. So we see ourselves as influencers in that process, so bringing evidence to the table that can be considered alongside all sorts of other factors that have to be taken into consideration when planning and commissioning services. And equally, in the work that we do, there is a role for a patient voice and patient participation in research, and also service participation in research is incredibly important to ensure that we evaluate and focus the issues and priorities that matter both to the people delivering the services, but also to people that are using the services.
And perhaps I could just add to that this is not at all sort of empty words, as it were, from the speakers. I think if John was here, he would credit the fact that what he called the parent and the autistic community voice has been actually critical in driving a lot of policy change and research, and Autistica relies a lot on that. So, you know, people often feel frustrated and powerless in this complex system, but just a little bit of encouragement that actually there has been a lot of movement. And I said at the beginning of the morning that, you know, we are all stronger and more efficient together. And I really meant that. We form a system together. The service users, families, autistic community, policymakers, professionals, researchers. This is the implementation system, as it were. And we can make change together, easier together. Let's move on to any other questions. I'm looking at the feed, and there are quite a lot here, which I could pick up some, but Tanya, have you got any what you want to highlight for us? So perhaps I'll just press on with some of the questions that I see on the feed. So
there's quite a lot about the language used around autism and
okay.
how the condition is described, and just to comment really on that about it being, you know, there's such a lot of variability and it being described in a positive way, you know, or using the terminology is very important. It's just a comment that someone made, and I think it is worth making again, that we don't talk about disability, we talk about ASC and accept things like that. I just wondered whether anyone's got a feeling about the language and how we refer to, how we speak with parents and people who come into the system.
Catherine, do you want to comment?
Yeah, it's a balancing act, and you know, parents do have sometimes their preferences, which we respect. Sometimes there is a case to have a sort of clear understanding of, to make a case for a child to get the right support, we need to be very clear, because if we play with words, we may not be understood, and a child's needs may be misunderstood. So there is a case sometimes for using clear terminology and using DSM-5 diagnostic criteria. But sometimes parents will, you know, or individuals with autism will express a preference, and we respect that. And I think that's really important, that it's that usually working together again, what is acceptable. But I think so internationally, so we all know, we have to have a common language so we all understand one another. And we've come from a history, I think, where we were using very many different terms to mean slightly different things. It was a complete confusion, and we didn't know what condition people were really referring to. And for research, we have to have a certain criteria, so we're very clear which group we are, you know, supporting, which group we're working towards, the best evidence base. And so it's that balancing act. But I do understand that sometimes people prefer the term, you know, neurodiversity, differences, and that's and that we are working towards understand the unique individual and what their attributes. And sometimes, you know, we have to be just clear and use the diagnostic terminology.
Another point somebody's actually just made, that a register of PACT trained clinicians might be a starting point for parents to seek out an appropriately trained professional. I'm sure Kathy or Jonathan could say something about that.
Yeah, that is exactly what our social enterprise is about. It's fairly newly formed, so we're at the very early stages of working. We have been going around talking to people at every level. Tanya has been in some of those meetings helping us, and Louisa, who you'll hear from this afternoon, has been very helpful. We have tried, we're talking to professionals, we're talking to parents, we're talking to commissioners. We're trying to look at representation from every angle, from people with autism, what they value. And it takes time to build up that team together. But we are getting some success, and I think this afternoon, that's what this afternoon is about. It's hearing about some examples of really good practice where people have weaved this into service delivery. There are challenges, and how they're addressing those challenges, how they're making it work in their service. And I think that's where we wanted to demonstrate some good examples of this is doable, and we are being persistent, and we want to move forward from this symposium with you to continue that work.
Another one.
Sorry, I was just going to jump in with a question that I see on the feed here about treatments into adolescence, and it's an important one. I just wanted to just comment on this, that we are talking about early interventions, as I said at the beginning, highlighting PACT, but you know, there are other ways of going at this. But autism is a developmental condition, and how we actually respond to the needs of autistic young people in adolescence and their families is a really important aspect. And it would be fair to say there is very little evidence to guide us with that. I mean, many of us who work clinically with autistic people through early development into adolescence do a lot of work with adolescents, and we fly by the seat of our clinical pants. In a sense, we are using all our repertoire of skills and intervention kind of modalities to help. But there is a lack of real systematic work looking at how to manage autism in adolescents. I want to just acknowledge that there's a lot of gaps in our knowledge and in the correct kind of service provision for adolescents and older people around transitions. That's something that, you know, remains work to be done, very important.
A question for Catherine, I think. I'm wondering which outcome measures of change you suggest are most useful for schools and therapists to use from your knowledge gained from success with PACT approaches and use of video.
Yes, we try to be helpful to schools in identifying the best outcome measures. So we have got some instruments that we use, and one of them is a teacher evaluation. It's a questionnaire that teachers can complete, and we've used this in our trial, but also it can be used in practice. For example, if the child, how engageable is the child, how easily does the child access learning, peer interaction, socialization of the child in the classroom, you know, the teacher experience of the teaching that child, and accessibility to the child. So we've got those instruments. We've got instruments where we looks at the quality of life. So, you know, parents were valuing sometimes just being able to go out into the community, being able to go for a cup of coffee with their child, or their child having friends, or being invited to a birthday party. Know how my child feels are priorities, and that's embedded within our quality of life questionnaire. And these instruments can help us reprioritize our goals as to what is important. You know, what are we working towards, and how should we work towards those important goals?
Thanks, Catherine. So I think it's time for us to break for lunch now. We've had a rich morning, and I'm sure everyone could do with a timeout.